Good morning, everybody. My topic is Clonosis Sinensis, right? The outline of my presentation is introduction, then we'll have pathogenesis and clinical manifestation, then we have life cycle, laboratory diagnosis, treatment, and prevention. So first, its introduction, Clonosis sinensis is commonly known as the Chinese liver fluke. It is the foodborne pathogen and cause of liver disease. People become infected by eating raw or uncooked fresh water fish containing the larva. Lightly salted, smoked, or pickled fish may contain infectious parasite. So it mostly infects your liver, your gallbladder, bile ducts, right? And it's common in Asia, right? This includes China, Vietnam, Korea, and Japan, right? And next is this is a classification of the Clonorchis Sinensis, right? The kingdom it belongs to Animalia, phylum Platyhelminthes, class Trematoda, and when we talk about the genus, it's Clonosis, and species it's Clonorchis Sinensis. So that's a small image of the Clonorchis, right? Then next we talk about is pathology, right? So pathology in pathogenesis of Clonorchis involves a complex interaction between the parasites and the host system, right? This leads to various degree of liver and bile duct damage. The parasite worm enters the human body through the consumption of raw or uncooked fish that are infected with the parasite's larva. Once inside, the adult worm resides in the bile ducts of the liver where they lay eggs. These eggs are then released into the intestine and excreted into the feces. So, the presence of adult worms in the bile ducts can cause inflammation, obstruction, and damage to the liver and bile ducts. This can lead to various symptoms such as abdominal pain, jaundice, and even an increased risk of developing liver cancer. And that's long term. So, liver cancer will only develop if that is not diagnosis and it is a long term problem. Then it's clinical manifestation. So in clinical manifestation of clonosis can vary depending on the intensity and duration of the infection, right? So asymptomatic infection. So many individuals with light infections remain asymptomatic and may only be diagnosed incidentally during routine examination. Then we have two phases. One is acute phase and another one is chronic phase. So acute phase here you will only have general symptom of infections, right? This includes nausea, vomiting, diarrhea, right? This only occur in the initial phase, right? Then we have chronic phase. This is when like after long time you did not diagnose chronic sinuses, right? So first we'll have recurrent right upper quadrant pain. Then we have jaundice, right? Then we have hepatomegaly, that's enlargement of the liver due to inflammation and fibrosis. Then we have cholangitis, so that's bacterial infection of the liver ducts, which can lead to fever, chills, and abdominal pain. Then we have complications. So complications includes chronic cholangitis, so that's inflammation of the bile ducts. Then we have biliary fibrosis, that's thickening and scarring of the bile ducts. Then we have liver cirrhosis, scarring of the liver tissue leading to impaired liver functions. Then we have gallstones. So here formation of stones within the gallbladder or bile ducts, right? Then we have pancreatitis. So this inflammation of the pancreas due to obstruction of the pancreatic duct. Then we have cholangiocarcinoma, a severe long-term complication. So this is a type of cancer arising from bile duct epithelium, right? And that's due to long-term effect, right? Then we talk about the life cycle. So in life cycle, first embryo-generated eggs are passed into the feces. That's here at one. Then two, yeah, two eggs ingest by the snail intermediate host, right? The snail it ingest that host, and then the free swimming encyst into the skin of freshwater fish. So the freshwater fish it ingests that, and after that the human five the human they ingest the uncooked fish. So then that Clonorchis sinensis it enters the liver of the human. So that's basically the life cycle. So eggs are ingested by a suitable snail intermediate host, right? And then eggs release mitochondria image, right? After that, infection of humans occur by injection of undercooked salt, pickled or smoked freshwater fish. After ingestion, the metacacia exists in the duodenum, right? After that, after maturation, approximately takes 1 month. The adult fluke is reside in small and medium-sized ducts. Then we have laboratory diagnosis. So in laboratory diagnosis, they only see ova and parasite stool examination. For liver fluke, eggs is the only available way to diagnose. So you will need more than one sample of stool to identify the eggs. Next, we have treatment. For treatment, for clonosis typically involves the use of antiparasitic medication. So here are two medications. One is praziquantel. So it works by increasing the permeability of the parasite cell membrane to calcium, causing paralysis and death of the parasite. Second is albendazole. So here this disrupts the microtubule function in the parasite, impairing its ability to absorb glucose, which leads to energy depletion and death of the parasite. Prevention and control. So preventing and controlling Clonorchis sinensis infection requires a comprehensive approach that includes public health measures, education, and personal preventive actions. For prevention, first we should avoid raw or undercooked fish since the infection is transmitted through the injection of raw or undercooked freshwater fish. The most effective prevention is to ensure that all fish is properly cooked before consumption. Also, health education, educating the public, especially in endemic areas, the risk of consuming raw or uncooked fish. So, also improve proper sanitation. Next is control measures. So, in control measures, we use community involvement or engagement involving local communities in prevention and control efforts, including education, sanitation improvement, and adherence to the safe cooking practices. Then we have screening and treatment. Targeted screening, identify and treating infected individuals, especially in high risk communities. And finally, this is the reference of my presentation. So if you want more information about this, you can just type in. And thank you for listening to my presentation. Hope you have gained some knowledge.